We have a sense that it's under control. However, we have 1 or 2 suspected cases that are reported to us each week. And of course, then we draw the blood, make an assessment, and wait for 2 weeks to get that blood back, and then we'll know whether it's actually a confirmed case. It really was an all-consuming effort of our agency and of the community as a whole. We pulled in all the possible resources that we could find. Those included students from the university that might be assigned to our health department at the moment. We used Hispanic interpreters from the school system, from other businesses or agencies, from Head Start, from Family Resource Center, from everywhere we could glean. We actually canceled clinics for a full week. We had maternity clinic off-site at the hospital who was very, they were just very open to whatever we might need, how they might assist us. We had a lot of calls for help, and we called in the National Guard. So we utilized every possible resource that we could, and it was like a 2 to 3 week thrust. Our sense is, well, it's not a sense. We actually know that many of the folks who come to our county to work are from Mexico and other countries where rubella has not been available. If it has been available at all, it's been available to the wealthy. Many of the individuals that we would interview, or in our efforts to case find, had measles vaccine, they thought, and it would have been the red measles, not the rubella. They did not have available to them the MMR that we give. Well, it's of major concern to pregnant women who might come in contact or even acquire the disease themselves, especially during an early trimester of pregnancy, the first 16 weeks. If that happens, there's up to an 85% chance that they will have an infant born with multiple birth defects, major organ birth defects, brain, heart, spinal cord injuries, blindness, deafness. We're also told in the literature that these babies may be born with congenital rubella syndrome. That means that they would shed the virus and be infectious to others for up to a year after birth. So that presents us an ongoing problem for anyone that we didn't identify or aren't able to detect at birth. It was not difficult to get them to get the vaccinations. It was difficult to get them to stay home if they were infected. They travel a lot, they're transient, and they socialize, and medical care in their country is not a priority as it is in ours. And we would find someone with symptoms and instruct them to go home and to stay there till 7 days after rash, and you'd find them at work the next day or at the grocery store or places that they didn't need to be because they were spreading the disease. So that was our problem. It was not difficult to get folks to take the vaccine once they understood what was needed. What happens now for us is to continue case finding as folks present, to monitor the women that we have discovered to be either cases or contacts of cases who were pregnant during this outbreak. In Chatham County, we identified 60 women. 5 of those pregnant were actual cases. I think it was 10 or 11 who were close contacts and who were not actual cases, but they had negative rubella titers, which means they are at high risk for having the disease. And although we may not have seen symptoms of the disease, it's possible in, say, 30% of cases to be asymptomatic and have no symptoms. So we will be following those babies as well. So 15 to 20 children over the next 6 to 9 months will need to be monitored throughout their pregnancy and throughout the next several years to see were there birth defects. Some may not be evident at birth. It may be sometime after birth before a birth defect is detectable.